Hello and welcome back to this series where we're going through practice test A of the UCAT practice papers. So here we're about to start the situational judgment papers section of the test. We'll be going through a walkthrough, so this is the first time that I've seen the test. I may get some questions wrong, I may get them right, or hopefully I get them right, and I'll be talking through my rationale as much as I can while the clock is ticking. So we've got 20 seconds left of the instructions in this particular section. While I've been talking to you now. What I would do is take the time to read through it, just relax a bit, breathe, and especially with the situational judgment, congratulate yourself on getting through the previous sections because now you're on the home straight. The situational judgment shouldn't be a difficult part of the test. Okay, so let's get started. Two med students, Chris and Justine, are about to complete a joint patient interview, blah, blah, blah. They're both taking part. Chris informs Justine that he's taken some drugs, okay, fine, to which he may be addicted. Now that came out of the blue from Chris, but nonetheless, we've got to deal with it. So how important is it that the joint interview goes ahead as planned? Well, not important at all. Like you can't have someone high on drugs talking to patients. So that's not important at all. Regardless of the plan, it now needs to change. Establishing whether Chris needs to seek help. Well, clearly that's very important. Like Justine has to sort of decide whether he needs to seek help, how serious is his drug addiction in order to justify a lot of what she does next. So A is very important. The consultant is made aware immediately that Chris takes illegal drugs. Now this one, the consultant needs to be made aware. That is very important. The fact that it has to occur immediately is what's throwing me off. So maybe it's very important, maybe it's important. It's definitely not C or D because the consultant needs to be made aware that person is the boss. They need to know whether Chris is taking the drugs. They need to know what the situation is. It's just the immediately aspect. I'm going to put it's very important because the sentiment is that the consultant needs to know. I don't think the emphasis is on this immediate in this question, but I'm going to flag it anyway. Okay, that Chris does not interact with patients. That is very important. We need to stop him from interacting. He can't be high on drugs when doing so. That's the whole rationale behind the previous answers. So this is very important. Okay, medical students Paul and Laura work together. One time the clinic receptionist informs Paul that Laura told her that in first year she submitted an assignment that she copied from a friend. Without the friend's permission, Laura is normally very honest. The receptionist is known to told lies about students and medical staff previously. Now, I don't know why Laura would just randomly volunteer the fact that she copied an assignment from years ago. Nonetheless, she may have done, and that's what we need to really be weighing up. So the alleged incident occurred a long time ago. Now with this, it doesn't matter. You need to act in a principled way. That's the whole point of the situational judgment test, your principles. It doesn't matter whether it was 60 years ago, 20 years ago, last week. It's still an issue that needs to be dealt with, so not important at all. When there's evidence, okay, that's very important. Clearly, we don't know who's lying here. Evidence is going to be our guide, so that's clearly very important to the handling of the situation. Laura's feelings, if she did copy her friend's assignment and this is uncovered. Now, this could be of minor importance if you're talking about Paul supporting her in the later down the line, because obviously if she's very upset, she's very hurt by it, she may need counselling and support, which Paul can provide. That's not clearly going to be B or A. It's not important right now, but it may be of importance later on. That being said, though, the sentiment is that Laura's feelings, should they get in the way with how we handle this situation for the majority of it? No, that is the answer. We should handle it in a very objective, factual way, in a principled way, irrespective of whether Laura feels upset or not. So I'm going to put not important at all. The receptionist's past history of telling lies. Now this, you may debate with yourself a lot about it, but the thing for me that tells me that this is either B or A is the fact that that's the crux of the question. I don't know whether this receptionist is being honest or not. It's clearly going to influence my behavior because if this receptionist is very diligent, very honest all the time, I'm going to investigate this quite seriously. If, on the other hand, she's basically psychotic and creating random stuff out of nowhere, then that's clearly going to mean that I just dismiss her concern. So it's definitely B or A. I don't think it's very important because regardless, even if she was completely psychotic, you still have to investigate it or at least consider it. So it's not going to affect your immediate decision. Do I investigate or do I not? But it would affect the subsequent decision. So that's why I think it's an important consideration. Okay, fine, we're on a different thing. Stephanie becomes concerned about the professional behavior. She's noticed that he's rude when examining them. It's clear that the patients are uncomfortable. How his behavior may affect the patient's perceptions of the healthcare profession. Now, that's either B or A. It's an important consideration that you can't degrade the healthcare profession, so therefore it's B or A. I don't think it's very important though, because that is wider consideration. It's not the patients right in front of you. It's talking about the future healthcare profession, etc., and their interactions. So I think it's going to be important rather than very important. Patients may withhold important. Okay, this is very important. That's the whole reason why we need to be supportive of patients, because we want them to confide in us. So this is a very important consideration, and it would get in the way of care if they did withhold information. Antonia's behaviour, if continued, may affect their willingness to help with future teaching. Again, it's a broader thing. The main concern is that the patients in front of us may feel uncomfortable, they may not share information, and they may feel unsafe in the hospital. Those are the primary considerations. This is a secondary consideration, but it is still important. It's not of minor importance because teaching is important. So B is probably more fitting. Antonia's negative reaction. Again, this is more about her feelings, and I don't think feelings are very well valued in situational judgment tests in general, so not important at all. Okay, she's a very good junior doctor, and a consultant praises her. Fantastic for Sarah. Okay. During the ward round, the consultant attends each of the patient's decisions are made regarding care. When attending, the consultant asks the urgent blood test. Sarah realizes that she's messed up, basically, and forgotten to do it. The patient's listening, though, and she needs to decide whether to admit. Now, in healthcare and as a doctor, if you read all the GMC documents, always admit to a mistake. It's better to be honest and transparent so everyone's on the same page. We can remedy the mistake than to try and conceal things. So anything that's going to suggest that Sarah should conceal something is going to be not important at all. So being honest, very important. That admitting may affect her reputation. That implies that we're going to be concealing it to save the reputation. That's not important at all. It's a selfish consideration. That if she does not admit the mistake, her fellow junior doctors may take some of the blame. Now, the mistake should be owned up to whatever, so it's not going to affect you regardless of what happens next. It shouldn't affect her whether she agrees to admit to it or not. Therefore, I think this is a secondary consideration, and therefore I think it's an important one, but not very important. The need to reflect on why she forgot to order the blood test and how to avoid this happening again. That's very important. Doctors love talking about reflection. In med school, you'll be doing a lot of reflection. Some people like it, some people don't, but nonetheless, reflection is very important to help you learn from mistakes. Okay, a med student notices a message on noticing. Classic. I don't even need to read the rest of it. It's talking about Mr. X. Obviously, it's got some photograph, the notes. Other students found it helpful, but he's given away some information. It's about patient confidentiality. So, Mark's message is likely to be seen by other students, and therefore it's likely that someone else will report. That's not important. She's seen it. She needs to act. The other students may benefit. Now, this isn't B or A, because the real concern is that we need to deal with this. We need to take away this post, basically. You need to protect patient confidentiality. However, it's not important at all. The sentiment was correct. It's about sharing information, helping your colleagues. So this is one that I would put minor importance, because clearly it doesn't affect any decision about what's done with the notes. But it is worth considering that some of the intention was correct. Okay, a dental student. She's originally good friends with everyone. Recently, one has become withdrawn, aggressive and rude, become to affect the atmosphere in the house. Emma was initially very friendly, her change in behaviour. Okay, with these change in behaviour ones, it's always worth considering if there's something behind it. Maybe she's lost a relative, maybe she's struggling with the exams or the pace. So it's worth considering all of that and not being too judgmental in these ones. So the Emma seems to be going through a difficult time, may need someone to talk to. That's very important, I think, at least. because it may be that you can diffuse the situation just by talking to her. That the situation may improve anyway without intervention. Now I'm going to put nothing at all, as in not important at all, because I think you can't just cling on. This is essentially the same as do nothing, which I think is always quite low down. So I'm going to put not important at all for that one. That Emma may not wish to discuss the matter. That is definitely not important at all. If you've got a housemate that's being a right pain and you've got a problem, you need to address the problem. With the situational judgment test, it's all about addressing problems. If you're not addressing the problem because Emma may not wish to discuss it, it doesn't matter whether you're looking out for Emma's feelings or not, you're just skirting around the problem. It's not important at all, therefore. Okay, now we've got a different one. Okay, she's got an opportunity to attend a clinical session. A student knows this session would be of value to her learning and development, however it will clash. Okay, so the importance of the meeting with the supervisor, very important. Like if this meeting was to discuss her progression through medical school, her recent exam results, clearly, it doesn't matter how important that clinical opportunity is, she needs to go to this meeting with the supervisor. If, on the other hand, it was just to say hi, clearly the clinical situation takes priority. That other clinical sessions may arise in the future that may be of value to her development. Well, yeah, that's it. That's definitely B or A. It is important because if this is just taking bloods on the ward, that would definitely appear again. You'll be able to get that opportunity again, so therefore attend the meeting with the supervisor. I think that that's very important to consider how likely this is to happen again. Her supervisor's view on whether it be valuable. This is outsourcing the decision, which should not really be done. I think when clearly her supervisor's view is important. You can't degrade the supervisor's view. He's got more experience and therefore is likely to offer some advice. I don't think it's very important though, because Emma thinks, is it Emma? Or is that the previous person? Or just a medical student? Because the medical student has already decided that it's going to be valuable. So therefore, it's irrespective of whether her supervisor thinks it's valuable or not, it's valuable to her. So I think that this is an important consideration. It's not a very important one though. Okay, Aquino or Akeno is on a placement in the emergency department. He's been approached by the ward reception, upset. Okay, they're talking loudly about the clinical details. They're concerned because it may mean that they've talked about them. Thanks for bringing attention. Apologizes. The patient wants to know what will be done. Okay, I will let the supervisor on the ward know. Clearly, that's what you're going to do. It's a very junior member, and speaking as someone who's been on the wards, it's not always easy to find a consultant. It's not always easy to find senior members of staff. Letting the supervisor know is a clear, good escalation plan. I think it'd be more appropriate if you spoke to the consultant that you're referring to rather than myself. I think that's inappropriate. I mean, you could say that it's appropriate because the person will therefore raise it directly, but you're kind of putting the onus on the patient when it may have taken a lot of courage to tell you in the first place. That being said, it's not awful because you're still appreciating that the concern should be raised. So I think inappropriate but not awful for that one. I will ensure that the consultant is made aware of this behaviour and a complaint has been made. Well, it doesn't really exactly tell the patient what's being done to remedy it, nor does it it also sort of will be difficult to talk to the consultant because they may not be around. So ensuring that you're going to talk to the consultant is quite a big statement. I would say that's appropriate but not ideal. It's more ideal to talk to the ward supervisor. Okay. Sean is a medical student working on a ward. He's been asked as a senior nurse to take a blood sample from Claire. Claire is aware of this. Sean is appearing to take blood, done it many times. However, when he introduces, Claire doesn't want him, basically, I think. Yeah. Okay. I've completed this procedure many times, so there's nothing to worry about. Now, with these, whenever someone is not acting in accordance to what seems to make sense, just like the previous housemate who was getting angry and rude, the first most appropriate thing is to ask them whether they need support, whether there's anything that's on their mind. Simply reassuring them like this is appropriate, but it's not going to solve the underlying problem. Would you prefer if I found someone else to take a blood sample? Now, this one I think is inappropriate, just because there's no one around. So I don't think it's awful though, because you're still treating it politely. Can you please extend what you're concerned about? Very appropriate. This is what I was talking about. If you ask that, if you say that to someone, they can say, I'm concerned that your experience is not very good, and then you can adjust that. Alternatively, they could say, I'm actually really terrified of needles and I need it to be done first time, and I want the most senior member. That's fine. It offers you more information that you can then respond to. I'm the only person available right now. There would be a delay if you prefer someone else. Again, it's not, I think it's appropriate because you're telling them this time about the delay. However, it's not solving the underlying problem. So again, appropriate but not ideal. Okay, Imogen's really keen to get this good grade. But Grace says, let's hurry up and get this done. So I don't want to spend too much time on this. I have more important things to be doing. A very common situation in med school, to be honest. Okay, I want to get a good grade, so I will do most of the work. I think that's inappropriate. You're not really addressing the problem and you're taking on a large workload. Shall we think about what the project involves and then we can work out how much time is needed? So question, it's open, it's polite, and it's creating a plan, so I think that's appropriate. We could discuss the workload, so we're both happy with the amount of time we're spending. And again, that's trying to compromise. I think that's appropriate. Okay, Kimberly is a med student, not GP. She's writing up her notes. Okay, we better speed up a bit as well. So I was trying to stop talking so much. Okay, this is Kimberly being a bit harsh. You can't just, this is an emergency situation. Inappropriate to sort of just palm it off to someone else. It would be appropriate to learn from him. It would be inappropriate to complain. It's an emergency, like you can't complain about someone collapsing. Highlight the patient to passing notes. Okay, someone's lost. Okay, they appear to be lost, fine. To passing nurse, okay, you haven't really certified any of the problem and you're just kind of palming it off to the nurse. So it's appropriate, but you're solving the problem, but it's not been done in the best way. Okay, this is great. The porter is the person to do things like this, and you're checking with the patient that they know where they're going. So this is very appropriate. Direct the patient towards the hospital information desk. I think that's inappropriate. Imagine if you're lost and you just point them back to the reception. I don't think that's going to help. Highlight the signage. Again, I think that's a bit condescending. So Maya is one of a group of medical students attending the mortuary. Someone's making some jokes. Now that might seem very bad, but people in the hospitals sometimes do have a dark sense of humour. It depends on the extent to which these jokes are disrespectful. So it's worth being tactful about it. But yeah, anyway, asking it quietly not to make such jokes. Very appropriate. It solves the problem. Do nothing. Inappropriate. Always inappropriate. Tell Nick in front of the rest of the group to stop making such comments. This is a lot more confrontational. So it's either B or C. Is it a good thing or is it not? I think it's a good thing. It deals with the problem, but it's not doing it in the best way. Take the registrars aside. Oh, this is a different question. I always do that. Okay. They're discussing patients in the lift. Okay, that's not good. So inform them that they're like to be overheard. I think this is very appropriate. I think all the words, take them aside, inform them, overheard, blah, blah. These are very appropriate. You would clearly tell them. Observe the registrar in other situations. That's inappropriate, really. Like, you're not really dealing with it. That's the same as doing nothing, except it is a bit better because at least you're doing something. You're observing, but you're not really acting. So it's inappropriate, but not awful. Whilst in the lift, inform the registrars that they should not continue. Yeah, absolutely. Tell them off, but in a polite way. Essentially, that's a very appropriate thing. A doctor is working in a team that's looking after Mrs. Martins. Doctor feels that the nurse is not contributing, they're late, they're not prepared. Okay, ask the nurse if there's a reason. Absolutely, always ask the question, is there a reason why you're behaving like this? It comes back to what we were talking about before. Tell the nurse that the issue will have to be raised formally. It will have to be raised formally. So I think it's on the appropriate side, but it's a bit of a threat, so I think it's not ideal. Ask the nurse if they would like support. Very appropriate. Even though you might think that's wasting your time and you're sort of faffing around after a nurse who's not doing their job, and that's not the way situational judgment sees it. It sees it as a team, and if a part of your team is struggling, you ask whether your team needs to be supported. Okay, Someone's worried about the infections, they've read something, and the doctor's not seen it, but they need to respond. So reassure that they consider it to be very important, very appropriate. And you would say that. I mean, regardless of whether or not he knows the specific data, clearly the hospital will consider it to be very important. So that is an appropriate thing. Offer to find out more. Absolutely. Like, that's a good way to diffuse the tension. I'll look into that for you. Okay, great. Two medical students, David and Ben, outpatient, they're examining. The first student performs it incorrectly, doesn't find. The second student performs correctly and does find. Okay, tell the patient that Ben performed incorrectly. This is inappropriate, and I think it's very inappropriate. You're apologizing for Ben, fine, but you're sort of embarrassing him in front of the patient, and it doesn't need to be done. So I think that's just it offers no benefit. Ask a specialist registrar to identify whether or not, get a third opinion. That seems reasonable, very appropriate. Ask the patient if he minds if Ben can re-examine and then show Ben where he thinks the abnormality lies. Yeah, and again, you've just got to think in common sense. If you and your friend approach a patient, you think that they've got a mass, the other patient, your friend doesn't think they've got a mass, obviously you would be like, what do you think about this area here? You wouldn't sort of discuss it and afterwards not point it out and then be like, oh, I thought there was something vaguely in this area. You would try and help them by like talking through it and showing him. So I think that's very appropriate. Discuss the incident with the again, it's changed, sorry. The junior doctor, Scott, is working on his first day. Scott overhears one of the nurses belittling him. The nurse implies that Scott is not competent and the nursing staff will have to deal with the outcomes of all the mistakes he is likely to make. Scott feels that comments are unfair. Fair enough, I mean, that is unfair. Discuss the incident with the supervisor. This is appropriate, it's not a bad thing. It absolutely is a good thing. However, it's not dealing with the problem in front of you, so it's not ideal. Discuss with the nurse later that day. I don't like the fact that it's later that day, but nonetheless, why her comments made him feel belittled. I think that's very appropriate. You're sort of asking the nurse to feedback, basically, and just explain their behaviour. Accept that junior doctors may be subjected. No, they shouldn't be. Okay. Greg, a dental student, is taking part in a clinical placement. They're all friends. Again, someone's made an inappropriate joke. Okay. But we don't know whether Marek... I think that's the difference. We don't know whether he is upset or not. So I think it is very appropriate to ask whether he is upset. Immediately challenge Amy. I think on the back, I would have put this as very appropriate. However, on the back of the previous question where we're double checking whether he is actually offended, I think immediately challenging is a good thing, but it's not great. Immediately report Amy's behaviour. I think that's very inappropriate. It's a bit of an escalation for nothing. And as a medical student clinically, okay, so he's taking blood, he's learned about it, but he's lacking confidence, he wants to practice, fine. Ask a junior doctor to supervise him. That's absolutely what you would do. If you're struggling on the ward, you ask for help. Obtain some needles and practice on his own arm. This guy is hardcore. I think we can all agree that's very inappropriate. Why would you be stabbing yourself with needles? Review his lecture notes. Now, you could say that's very appropriate because it is. I mean, it's not a bad thing. But the whole point is he wants to practice the practical aspect of it. So I think it's appropriate, but it's not ideal. He's not going to gain much from it, but it's not going to be a bad thing. Okay, dentist is checking a routine checkup on a 10-year-old boy. During the checkup, he starts crying violently. Ask the boy's mother to try and calm him down before proceeding. The before proceeding is what's bugging me here. Like, it just sounds like you'd be like, oh, come on, mum, calm him down, and then I'm going to crack on. So I think it's appropriate. I mean, it's a good idea, but it's not going to be the best thing. The best thing would be to just stop for a second and take a break. Yeah, exactly. Stop the checkup and ask the boy some questions to put him at ease. Absolutely. Very appropriate. Final 4 questions. We've got 3 minutes to do them in, so we're all good. Fine. Okay, Sam's feeling as if he's done more work than everyone else. Fine. Suggest that you should have said it sooner. I think that's probably going to be the least appropriate. Imagine if someone said, oh, dude, I'm really annoyed. I'm doing all this work, blah, blah, blah. And then you turn to them and go, oh, you should have mentioned this earlier on, so nothing I can do now. Clearly that would be inappropriate. Acknowledge that he's done lots of the work, suggesting that they discuss redistributing, or acknowledge that Samuel has done the work and offer to complete. I think suggesting it to the group is a better thing. If you can offer to complete, you're kind of taking it all on yourself. Today, someone's late because they take the children to the nursery. The session is a bit ruined. Okay, so ask if he's considered sending his children to a nursery that episode. That's not your place to say at all, and that you would likely annoy Jeremy massively. So I think that's least appropriate. Speaking to the facilitator to see whether you can change the time is probably going to solve the problem and is not confrontational. Explain to Jeremy that his lateness is affecting. I mean, that is somewhat appropriate, but it's also kind of guilt tripping him for something he can't control. Whereas this one is a lot more constructive about the whole thing. Teresa is observing Ross. Okay, she notices her dressing looks dirty. Ross has moved on. She's never done it before, but she's been taught how to do it. Okay, fine. Ask the patient if he would like her to change the dressing. She's not done it before. She needs someone to supervise her. So the way it works in medicine is you see one, do one, teach one, and you should always be supervised every time that you escalate. So if she's got no one to supervise, she shouldn't really be changing the dressing. So I think that's probably least appropriate. A nurse is probably the best person. The local GP probably is an intermediate option. And finally, we're moving on to question 66. Now, my computer previously died just as I reached this question, so we've not got the timer anymore, but we would have enough time to answer it anyway. I think we had about just under a minute left. So looking at this, Sky and Graham, they're good friends, they're completing a placement. Graham is depressed following a breakup. Tough. They used to meet up in breaks, however now Graham spends most of his time alone. Okay, so essentially, we need to pick the most appropriate and least appropriate. Here, advise him to take some request some time. Well, that's his decision. You can sort of suggest it, but I don't think it's most or least appropriate. Monitor Graham's behaviour over the next few weeks. That's least appropriate. I think that's the same as doing nothing. And finally, ask Graham if he would like to speak with her after their shift's finished. I think that's most appropriate. Asking a friend what's going on, how you can help, I think that's always going to be most appropriate. So I'd say this last one is most appropriate, this one is least appropriate, and this one is in the middle. Okay, and that's the situational judgment test part over. In the next video, I'll be going through all of the answers we just discussed and go through the incorrect answers as well. Thank you very much.